We live in a world where everything is changing. Evolution refines and improves each generation. And much like we see with this personal computer that has evolved from the abacus, it is not yet finished in its evolution because further improvements can be seen, can be had. And in the evolution that we see in the human body, we start with a structure that evolves into something very elite, very efficient, but not yet perfect. Healthcare systems also evolve. They must evolve. The same way that the human being evolves, the same way that computer systems evolve, healthcare systems also evolve. And the question is, why do they need to? The first point is that people want to live longer. People want to live a better life than the generation that preceded them. And they want to accomplish those two goals at lower total healthcare costs that have been obtained up to the present time. The challenge that we have is, can this be accomplished? Can we enable people to live longer? Can we provide a better life? And can we provide a healthcare delivery system that enables that to happen at lower and lower costs than have been achieved before? That set of requirements establishes demands, gaps, on the existing healthcare delivery system and methods. And those gaps result in new demands on the academic community for research and new curriculum, new demands on private industry for innovation, new demands on doctors who are already out in the public space treating patients to remain current, to maintain their skills and improve their skill sets beyond what they obtained when they left college. So postgraduate education becomes an important element in filling those gaps. There are new demands that are placed on government and private insurance systems to remain under budgetary control, provide longer life, provide a better quality of life, and provide lower and lower healthcare system costs than have been obtained before. And what we end up with is a model. And the model is that the patient expects a success rate of 100%. Any treatment that that patient will be subjected to, their expectation is that the treatment will have a 100% success rate. But there's also an expectation on the system that the cost associated with that treatment is at a lower and lower cost, and the best state would be a cost of 0. So the probability of success for the treatment is 100%, and the total cost is equal to 0. In order to address the changing demands in the healthcare systems today and to meet patient expectations, we must have new patient assessment and evaluation technologies. Those technologies and those methods that brought us to today are not necessarily the technologies and methods that will enable us to go through to tomorrow. The methods must utilize more and more measurable criteria, objective criteria. To the doctor, there must be more and more real-time information that that doctor can utilize in his or her diagnosis and development of a treatment plan. These methods must support a wide range of treatments that the doctor can utilize under any patient condition. And the doctor must be able to accurately assess the patient condition to discover what the issues are with pinpoint accuracy. And the reason for that is simple. If the expectation on the part of the patient is a probability of treatment success of 100%, at the lowest possible system cost, then we have to be able to get to the diagnosis very quickly, very efficiently, and with pinpoint accuracy. That then brings us to the need to have a coherent treatment plan that we can implement, but also have the need to be able to monitor how effective is that treatment plan working in relation to the patient's expectations and our need to be able to deliver the solution that's required. The end result is we have to arrive at a least cost solution with the highest success rate. Today, we thank you for the opportunity to be able to present to you a technology and treatment protocol that falls into an acceptable state of meeting the new patient treatment model. And it's our belief, based upon our research and actual clinical use, that the patient expectations will be met. And we call this protocol multiple impulse therapy. With that, I'd like to introduce to you Dr. Joseph Evans, who is the father of multiple impulse therapy.